Evening. Welcome to this webinar from MS Focus, the Multiple Sclerosis Foundation. I'm Sherry Binns, the Patient Healthcare Liaison for the Foundation, and I'm happy to be joined this evening by Dr. Megan Weigel, a longtime friend. Megan is a nurse practitioner specializing in neurological care in Jacksonville Beach, Florida. She has been a multiple sclerosis certified nurse since 2005 and has been a nurse practitioner for more than 20 years. She's also board certified as an advanced practice holistic nurse, and she'll tell you more about that as she gets into her talk. She earned her doctorate of nursing practice from the University of Florida, where her research emphasis was on preventive healthcare. She completed a fellowship in integrative medicine at the University of Arizona, which complements her practice focus on wellness and holistic care. Megan is the past president of the International Organization of MS Nurses and the co-founder of OMS Yoga, a nonprofit organization that brings free yoga classes to people living with MS. She has a best-selling book, Monday Mantras with Megan, and that's available on Amazon if you wish to look for that. So without further ado, I'm going to turn this over to Megan and take it away, my
Thanks,
friend.
Sherry. Oh, I don't know that we've ever done one together like this. It's so great. Sherry's been such a wonderful mentor for me over the years, and it's nice to be together. All right, I'm going to share my screen.
And I'm going to turn off my camera.
Perfect. And then we'll go here to slideshow. And here we go. So welcome tonight. It is getting steamy hot here in Florida. I'm not sure where you guys are, but I'm sure that most of you, if you are steamy hot like me, are experiencing some uptick in your symptoms because of heat exposure. And so it's an appropriate time to talk about managing those symptoms. And I'd like to give you basically a holistic nurse's viewpoint on managing your MS symptoms. So we'll talk about the basics of MS today, and I can't see who's on the call, but I'm sure many of you could give this part of the talk. You're so experienced in living with multiple sclerosis and living with people with who have multiple sclerosis. But there's probably some of you who are new to the diagnosis as well, and may find some of these facts interesting. And then I'm going to dive right into talking about integrative medicine and then MS symptoms from a conventional and an integrative approach and how those things are different and maybe what's missing from your care that could become a part of it. And finally, at the end, I'm going to talk about things that are really close to my heart. These are safe complementary strategies for symptom management that can be part of an integrative plan of care. And basically, most of them are energy medicine techniques. Some of you may listen to a podcast. I just did a podcast specifically about why I think energy medicine is important. And so I was excited to be able to bring this into today's talk. So background info on MS, what is it? It's an autoimmune disease that causes demyelination of the central nervous system. And demyelination basically means that the coating around the nerves in the central nervous system gets eaten away. And it gets, I use eaten as a visual term, but basically the inflammatory process of the immune system gone awry causes the myelin sheath to dissolve or to die back, or any number of things. And this is what causes the plaques on your MRI, and then the plaques in turn are what cause your MS symptoms. Around 1 million people in the US, probably a little bit more at this point, have MS. 3 to 4 women to 1 man have MS. And actually, we know now from diversity and inclusion studies where we're looking like just much more broadly at who has MS, that there's likely not this significantly uneven distribution where more whites have the disease than blacks. In fact, it's probably more equally distributed. We do not know what causes the disease. We know that there's a relationship between low vitamin D, between smoking, between a history of having clinical mononucleosis, and also obesity in adolescents that can increase the risk. And we treat MS three ways. We treat it with disease-modifying therapy, we treat it with relapse management if a person's having a relapse, and we treat it with symptom management. Today, we're going to focus on symptom management, and I'm going to help you look at your symptoms from an integrative standpoint. So what is integrative medicine? I love these two definitions. The first one is it's a healing-oriented medicine that takes account the whole person, all aspects of lifestyle, and it emphasizes the relationship between the practitioner and the patient. It's informed by evidence, which is really big in integrative medicine. There's good evidence that what we tell you to do works, and it makes use of all appropriate therapies. In addition to the above, it focuses on the least invasive, the least toxic, and the least costly methods to help facilitate health by integrating what I was trained to do in nursing school, what your physician was trained to do in his medical doctor or doctor of osteopathy program, what your PA was trained to do conventionally, but also using complementary therapies. These therapies are recommended to you individually based on your physical, emotional, psychological, and spiritual aspects of yourself. And my favorite part is that integrative medicine maintains that healing is always possible, even when curing is not. And some of you may say, well, how is that possible? How could I possibly heal if my disease isn't cured? And I would reference a couple of patients who have said to me, MS is the best thing that ever happened to me. It caused me to face my fears about life. It caused me to make major lifestyle changes that radically changed my health. Or folks who have other serious diseases like cancer, who have had incredible healing journeys with loved ones because of their illness. And so the illness didn't go away, but their power to heal, their spirit and their heart did get better. And that's what I like to focus on in the latter part of the talk. So these are the symptoms we're going to talk about tonight. We're going to talk about fatigue, cognitive issues, neuropathic or nerve pain, bowel and bladder dysfunction, depression and anxiety, and spasticity. So these are some of the more common MS symptoms. And also the ones that can be, easy to treat if the first treatments that we recommend work, but then also can become more difficult to treat over time. So let's talk about fatigue. It is, let's see, what time is it? It's 7:08 p.m. on the East Coast. For many of you, it's late. You're kind of looking to shut things down, go to bed for the evening pretty soon. But the fatigue in MS is not really a sleepiness. If you're having sleepiness, there's a different problem. The problem could be sleep apnea. The problem could be thyroid issues, vitamin deficiencies, depression. The fatigue that comes with MS is like, if those of you on the call are old enough to remember, like me, the old TV screens where like when the TV would get old and you would turn it off and it would kind of go, wah, and the color would just disappear in the center. It's like you pull the plug. That's the fatigue in MS. You can't go more. You just can't do it. Usually naps don't help. They might give you a little bit of a swift kick in the rear for a short period of time, but they typically don't reverse the fatigue that you're having. So what a conventional healthcare provider would do when you come in with MS saying fatigue is really becoming a problem for me is they look for other causes. And these causes I've mentioned and they're listed here. And then they'd offer you medications. And medications for fatigue that are most often used are modafinil or desmodafinil, which are Provigil and Nuvigil, amantadine, amphetamines, possibly dalfampridine, which is Ampyra, depending on what part of the country you're from, for motor fatigue, and then maybe some certain antidepressants like bupropion or Wellbutrin, maybe Trintellix. And the problem with those medications is that none of them are FDA approved to treat MS-related fatigue. Dalfampridine is approved to improve walking speed. Many of them are harmful. So being on amphetamines for the rest of your life, not so great for the heart, not so great for the brain. Similarly, modafinil, desmodafinil may be a little bit safer than amphetamines, but at the same time, there can be stress on the heart. And, you know, by just offering a prescription, it takes, in my opinion, the empowerment out of the person who lives with MS, who might say, well, what else can I do than just take a prescription for this? There has to be something else, and there is. So an integrative approach looks for causes other than MS, just like your conventional healthcare provider, assesses your nutrition and your hydration status, because guess what? Being dehydrated can cause you to wilt like a little flower and make you tired. Help you develop goals for daily movement and exercise, because actually exercise improves fatigue. May encourage you to spend time outside in the real sunshine, not just eating your vitamin D with cooling equipment, of course, because being outside actually improves endorphins. Being outside is good for the soul, it's good for the body, and might offer supplements. So there's some fairly good research in MS that shows that the amino acid acetyl L-carnitine 1,000 milligrams twice a day can help MS-related fatigue. And low dose naltrexone, which some of you may have heard of, may also help with fatigue. Now, I'll go back to diet and hydration for a second, because truly this is where your money is. If you want to put your money somewhere, you put it in nutrition. All of the nutrition studies for MS diets show improvement in fatigue and well-being. They're also beginning to show improvement in disease endpoints. And so really, if you want to make a radical change in your health, you start with healthing up your diet. So that's fatigue. So now we're moving on to cognition. And guess what? Fatigue and cognition go hand in hand. When you're tired, you can't think straight. When you're trying hard to think because you have cognitive issues related to MS, you get fatigued. So there's actually a cognitive fatigue that I bet some of you experience. And you might not have known what that is until I just mentioned it. So similarly to fatigue, we look for causes other than MS. And some of these causes are the same: thyroid issues, vitamin deficiencies, sleep disturbances, but also medication side effects from pain pills, seizure medications, antispasmodics, and then also depression and/or anxiety, like with fatigue. And then we typically refer people for neuropsychometric testing, which is a long battery of tests that you do with a neuropsychologist to try to pinpoint exactly what's going on with your cognition. Are there attentional issues? Is it really a cognitive loss for multiple sclerosis, or are you just very worried about it and actually you're cognitively normal? And this can direct us to cognitive rehab. Now, neuropsychometric testing isn't necessary. If you have the ability, if your healthcare provider, your MS provider has the ability to assess cognition with this symbol digits modality test in the office, that's really the gold standard of assessing cognition in an office visit, but it's expensive for clinics to buy, and oftentimes there's not time to do that. So you get referred for more comprehensive testing, which I don't think is a bad idea. And then you go to cognitive rehab. It's physical therapy for your brain. It's great. I refer people to cognitive rehab all the time. People from the ages of 20s to 70s who've had MS from anywhere to 0 years to 40 years. And they go to cognitive rehab and they come back and they feel good. They're like, I did it. I remembered things. I did my homework. I improved. I saw the results. So it's great. And then let's bring in the integrative approach. So we do the same things. All these things are really important. But then we talk about the basic tenets of brain health and making lifestyle modifications to improve on that. And look at what the first one is: diet. And it's not diet, like going on a diet, it's nutrition. It is how many colorful plants, vegetables, and fruits are on your plate during the day. How healthful is the supply of animal protein that you're getting if you are indeed eating animal protein? Are you eating healthy grains? Are you eliminating processed foods, trans fats? Are you reducing alcohol and sugar consumption, processed sugar consumption? And picking just one of those things to work on can really change your life. Exercise, moving your body the best way that you know how, being social. So going to support groups, going to meet your friends to play bridge or bunco or bingo, going to church or temple, any type of social activity. Many of you exercise together, attend family events together, very good for your brain. Stress management, also very good for your brain. So here's a great example. It's 6:58. I'm trying to log into this meeting. It's not working. I had everything planned out. I did my talk ahead of time. I got it to the MS Foundation ahead of time. And last night, my son woke up with a stuffy nose and a headache. And he's been awake for about 15 minutes today. And most of those were in the doctor's office when he was throwing up after his throat culture, and he has strep. And so in the 30 minutes before the talk, I had to text a neighbor and ask them to get my pick up my prescription for me so I didn't miss the talk and I couldn't leave my son alone. And here comes the talk. And Sherry says, "Do you have your slides?" And I said, "I sure do." And I just took a deep breath and I could not remember where they were on my computer. It took me about 30 seconds to figure it out. So when you have all this stress going on in your brain, you can't think. So stress management is key for cognition, as is sleep. I do think that brain training really works, which takes me back to cognitive rehab and then managing other medical conditions so that you protect your brain. And what are other medical conditions? Well, diabetes, high blood pressure, obesity, high cholesterol, smoking, quit if you smoke. There's no reason to smoke in 2024. So managing these other medical conditions that essentially are toxic to your brain, increase your risk for dementia, and rapidly increase your risk for higher levels of disability and MS will significantly improve things in your life. Let's talk about pain. So neuropathic pain is the pins and needles, burning, stinging, walking on pebbles, painful. I'm trying to think of other adjectives. Fire type pain that can happen from nerve injury, from neuropathy, from the Lermite sign when you touch your chin down to your chest, from eye movement issues because of optic neuritis. And so a conventional provider would assess your pain, rate it, and then treat with medications like gabapentin, pregabalin, perhaps tricyclic antidepressants like amitriptyline or nortriptyline, duloxetine, which is the generic for Cymbalta, or venlafaxine, which is generic for Effexor. And then for other types of pain, like pain related to arthritis or to body mechanics, they might refer you to an interventional pain specialist who could do injections. If nerve pain becomes too bad, then other interventions like opiate therapy, nerve blocks, spinal cord stimulators, and pain pumps are considered, and those are usually offered by pain specialists. Integrative approach to pain is a lot different. And so, of course, we assess pain. We also talk about nutrition. You're going to hear about nutrition a lot. We might consider low-dose naltrexone, which has been shown to be helpful in small studies for fibromyalgia type pain and other types of nerve pains. And then we might focus on mind-body therapies. So these mind-body therapies have really good data that show that they reduce pain, not just in the moment, but over time. So guided imagery is like a guided meditation. It is essentially a distraction technique, but it also reduces your sympathetic nervous system response to pain. Similarly, mindfulness activities and biofeedback, which I'll talk about later, can be helpful. And then we might recommend manual therapies for pain, types of energy medicine, acupuncture, acupressure, or massage. So you can see that as we're talking about symptoms, there's just an increased armamentarium of things that you can do that follow the integrative path. In bowel and bladder dysfunction, a conventional provider would send you to pelvic floor rehab, try medications for bladder issues. These often worsen constipation, and then possibly refer you to urology, and a urologist might offer Botox or a bladder stimulator, other trials of medication. When you have bowel dysfunction, which in MS is usually constipation, there are other problems, but most of the time it's constipation. You're told to increase your fiber and your water intake, to use stool softeners, bowel stimulants, and you're often sent to GI to make sure that nothing else is wrong. An integrative approach would most definitely involve pelvic floor rehab. It would talk to you about what you're possibly doing in your diet that could affect your bowel and bladder. So some of the worst offenders for bladder issues like frequency, urgency, and hesitancy are artificial sweeteners, caffeine, alcohol, sugar, spicy foods, and citrus foods. And so I have had patients with bladder dysfunction to the point where they were ready to start on a medication, cut their caffeine intake in half, and take out artificial sweeteners and sing the praises of glory because they didn't need to start medication. For bowel issues, we definitely want to increase fiber, and I would encourage you to do that with food rather than a fiber supplement, but some people need a fiber supplement. You cannot take a fiber supplement without adequate fluid. If you do, you will just have a brick sitting in your stomach. It's not going to go anywhere. And you have to move your body, you guys, however that is meaning, however moving looks like to you, whether it's stretching, whether it's having someone move your limbs for you, whether it's just twisting from side to side, whether it is using a hand bike or pedaling a foot bike, any kind of movement that you're able to do helps with bowel and bladder function. Things like yoga, acupuncture, and breath work, which causes stress reduction, actually can also help with bowel and bladder health. Breath work and stress reduction help reduce the spasticity of the pelvic floor, which is often what is causing the constipation. Constipation can also be caused by anxiety. Irritable bowel syndrome was long known as functional bowel syndrome, which means it comes from up here. So using stress reduction techniques can also be very helpful. And actually, irritable bowel syndrome is a good segue into depression and anxiety. Conventional healthcare providers would assess for other causes, and you can see those here. They would potentially recommend medications, things like Zoloft, Lexapro, Wellbutrin, Effexor, Trintellix, Vibrate. I could go on. And they might refer you to counseling. That, that's not always something that's done, and it might be done in reverse order. An integrative provider would assess for other causes, would most always refer to counseling, would definitely talk to you about nutrition and the way that healthy foods that are rich in nutrients, good for your brain, good for your body, and how it makes neurotransmitters can improve your mental health. Encourage you to exercise, again, to move your body. It is the best, cheapest natural antidepressant that has virtually no side effects as long as you're doing it for your body. Encourage you to get outside, get fresh air, be in the real sunshine. Forest bathing is a real thing, and it basically means walking outside in the woods. It's a Japanese form of medicine, and there's a movement here in the United States, actually in our national parks, to get people out in the woods and getting enjoying natural medicine. Grounding is something that I find fascinating. I find it most fascinating because of how many people ask me about it without me saying anything. And grounding is simply walking around barefoot on the earth or on the sand, not just around your house. And there is a theory that that connection between your bare foot and the earth provides almost like an electromagnetic force that allows you to have a sense of safety, a sense of oneness, a sense of well-being. And if you cannot walk or cannot get your feet on the ground, you can actually get grounding mats. I have one right here. You can get them in all kinds of sizes. Mine's about, sorry, my background's fuzzy. It's about, I don't know, 24 by 18 inches. And the plug for it goes into the center of an outlet. So it's like the grounding part of the outlet. And then you just put your feet on it for as long as it feels good to you. There are actually grounding sheets that you can put on your bed. And, you know, many people are sensitive to this type of energy and find that it actually helps with pain, helps with energy, helps with mood. I can't give you science for all of that stuff. This is more empiric evidence. And then for depression and anxiety, mind-body therapies can be very helpful. Again, we're going back to the guided imagery, the mindfulness, the biofeedback, and manual therapies that include energy medicine, acupuncture, acupressure, and massage. And we'll talk about most of these in greater detail here in a few minutes. Spasticity is a big one. And spasticity affects everything. When you're tired, you're more spastic. When you're spastic, you're more tired. When your bladder is full and your bowels are full, if you have spasticity, it's worse. Similarly, spasticity can prevent you from emptying your bowel and your bladder. And traditionally, we give people muscle relaxants. We refer them to physical therapy. If those things aren't helpful, we move to the baclofen pump and sometimes even Botox for spasticity of the limbs, the hands and the lower extremities when they're really drawn tightly together. An integrative practitioner would make sure that you're drinking enough water, would make sure that you have appropriate bowel and bladder management and talk to you about how that is potentially affecting your spasticity, would refer you to physical therapy, would probably recommend yoga, and would also suggest manual therapies like massage and acupuncture. And I would add acupressure there anywhere that you see acupuncture. So quick, run through of those integrative approaches to common MS symptoms. And I would say that none of them are very complicated. So I'm fellowship trained in integrative medicine. I'm an advanced practice holistic nurse. I'm super into the woo-woo. I do it for my own self. And so I know these things, but I also know that I'm just going to go backwards here. If you asked your neurologist if acupuncture might help you, he'd probably say yes. If you asked your neurologist if he knew anything about biofeedback or for depression or anxiety, he might not, but he might know a practice that does biofeedback. Some of these things are not really complicated. They're just kind of common sense. And actually, I think Sherry would agree if I could see her face that many of these integrative approaches are actually drawn from good old-fashioned nursing care. All right, so nitty-gritty. I want to talk about my favorite complementary therapies. I'm going to talk tonight about acupuncture, acupressure, biofeedback, something called neuro-emotional technique, Reiki, and then diet. And why did I pick these specifically? Well, I do them. So I'm certified to do many of these, not all of them. But they have a minimal risk for harm. They can be cost effective. So typically these are things that might even be covered by insurance or that you could use a health savings HSA or an FSA card to pay for your copay. And these are the types of therapies that may help with symptoms that nothing is helping. I've tried everything and nothing helps me. These are the type of therapies that just might do the trick. So let's talk about acupuncture. It is a centuries-old practice. The way that an acupuncture physician assesses illness is by looking at pathways along the body called meridians. And these pathways are assessed for blockages, and typically they're assessed by checking pulses, by looking at your tongue, by looking at the color around your eyes. And by pulses, I don't mean the pulses that your doctor checks. They're different pulses on different parts of the arm. And sometimes just by listening to you, by listening to the sound of your voice, smelling the way that you smell, hearing what types of problems that you're having can give a very good acupuncture physician a clue as to which meridian is blocked. Acupuncturists use hair-thin needles, like they're literally bendable, to move energy and remove the blockages. And so it allows the flow of energy to, to move unblocked throughout the body along the meridians, which improves health. In MS, there's research that says it can be helpful for symptoms like pain, spasticity, nerve pain, bladder issues, depression, anxiety, and fatigue. And some insurances do cover acupuncture. In fact, many Medicare plans cover acupuncture, which I think is amazing. The most important thing to look for in an acupuncturist is checking credentials. The type of credential an acupuncturist has to have varies from state to state, but in general, they all should have to be certified. They have to be licensed, kind of like as a nurse. In order to practice nursing, I have to be licensed. Now, acupressure is a little bit different. So an acupressure practitioner uses similar theories as acupuncture, but there are lots of different styles and types of acupressure, and they may incorporate different elements. Like some types incorporate colors, some types incorporate essential oils. The type that I am trained to provide incorporates elements of the chakras in the protocols that are used for acupressure. But using the same meridians, fingertip pressure is used to encourage the body's movement of stuck energy. So you are your own healer. As the acupressure practitioner, I am not healing you. I am providing your body guidance as to how to heal itself. It's helpful for the same symptoms as acupuncture. And it may be more helpful for people who have significant pain that have very hard time with touch therapies. Like people with really bad fibromyalgia oftentimes can't even be, can't even have like a light touch. And the pressure of acupressure is similar to like laying a dime on your skin. It's very, very light pressure. For an acupressure practitioner, you should look for a license to touch. And so that would be a nurse, a physician, a chiropractor, a massage therapist, PT, OT, and then specific training or certification programs. Like I hold several certifications in acupressure from a school called Soul Lightning. Biofeedback, which you've heard me mention many times, really gives you the power to control your body's involuntary functions. Biofeedback can be incredibly empowering, and there are different types of it. Some types use heart rate, some types use breathing, some types use brain waves like EEG technology to reduce symptoms like pain, anxiety, and insomnia. And what you're doing is you're looking at your body's rhythms, your heart rate, your brain waves, whatever it may be, while you're talking to the biofeedback practitioner. And then you're learning techniques to change the way your body responds to certain stimuli, and you can see what happens. It's kind of like the old Pavlov's dog, right? You give a dog a treat for doing something, it keeps coming back and doing the same thing to get more treats. So your body actually really wants to feel good. And so you're going to use the feedback to encourage your body to feel good. It teaches you to shift negative responses to positive ones. And it has very well documented scientific literature for improvement in headache, pain, depression, anxiety, insomnia, performance, both sports and testing performance, hypertension, bowel and bladder issues, and ADHD. It's also covered by many insurances, and eventually techniques can be done on your own. So I practice a type of biofeedback called HeartMath, which is built, I guess the vision, I would say, is more of a universal energy type vision. And there's a little bit of, I would call it guided imagery with some of the techniques of HeartMath. And you are taught to go practice those things on your own, so you can take it with you. If someone is doing biofeedback, you definitely want to ask about licensure and certification, because these are types of therapies that can get into psychology and emotions, and people should be certified and know how to handle emotions as they come up. Typically, counselors, social workers, and nurses are biofeedback practitioners. Some physicians do become biofeedback practitioners. Neuroemotional technique might be something that you've never heard of, and I love to share about it. It is a mind-body stress reduction technique that was developed by a chiropractor and incorporates muscle testing and homeopathy. So if any of you have been to chiropractors that use muscle testing before, you know what I'm talking about. For those of you who haven't, muscle testing is a technique that is scientifically proven to allow a practitioner to assess something in your body using a muscle test. And I'll just put my arm up. That muscle test kind of looks like this. So I'm feeling for your body to either be tense or to relax based on a question that I ask it or information that I give it. And in this case, the information is around either an emotion or an event. Doesn't take the place of psychotherapy, but it certainly can be helpful and complementary when a person is receiving therapy or just wants to work on an issue. Practitioners of NET have to be graduates of an advanced professional degree in the healing arts, so have a bachelor's or higher degree and at an accredited college or university, and they have to be currently licensed and or registered or certified practitioners by a state board and have taken coursework in neuroemotional technique. And I'm just going to share the brochure because I think it explains it the best. So our emotional reality can dramatically affect our health, as you guys know. And you may have heard the term, the issues are in your tissues, and literally things can get stuck in our bodies. So using NET, we find stuck negatively charged response patterns and help release them. And it's fast. It also is actually based on Chinese meridians, like acupuncture, the same types of things. And what happens is you, as the patient, form a mental picture or a snapshot of an event that triggered you to feel or act a certain way. And then the practitioner contacts that specific meridian. And then there's a breathing technique that goes along with it to release that negative emotion. So does everyone have stuck stress patterns? Yes. So the developers of this have found it to be true that everyone has stuck stress patterns. Why are they stored in the body? Well, no one really knows, but our body is our house, right? So I don't know where else they'd be stored. And why are homeopathic remedies sometimes recommended? Well, the homeopathic remedies, I guess, spirit of the plant, so to speak, is thought to help move those negative emotional complexes along. I think that's it. And so NET is a technique that can take 2 minutes, and then there's a technique that is 15 minutes or longer. You can sometimes get into these really complex neuroemotional complexes that you can go roundabout with for an hour and a half to 2 hours to really help a person resolve a deep-seated issue. And then Reiki is something that many people have heard of. It's a relaxing form of energy healing during which the practitioner places hands on or just above the body to deliver energy. It promotes relaxation, peace, healing, it relieves tension, and it supports the immune system. It supports function of the immune system, whether you're sick or whether you have an autoimmune disease. It supports the process of healing for those problems. It's important to check for certification from a Reiki practitioner, and whether or not a person has a license to touch. So, for example, many people can practice Reiki, but a person who, like in the state of Florida, who's not a nurse or a massage therapist or someone else with a license to touch could not touch you legally. They could practice Reiki by keeping their hands over top of you, which is just, can be just as effective. But these are techniques that, I would venture to say most towns have if you look hard enough. Many people find them to be incredibly healing, even when a cure is not possible. Many people find them to be incredibly effective for symptoms for which nothing has been able to help before. And they're things that you don't necessarily have to keep doing on a regular basis. You can do them for specific problems, for a specific period of time. You can do them when the seasons change. You can do them around important events in your life, things like that. So there are things that you can try, and I would encourage people to try things more than once, unless whatever you did caused you to have a significantly, harmful stress reaction or something like that. So moving on to diet changes, I could sit here and talk until midnight about that. I'm not going to do that because I'm starving. um, so I'm just going to say a few really basic things. The right diet for MS is the one that you follow. It's not the one that your neighbor's doing that you think is going to be so hard. It's not the one that your aunt calls and tells you that you have to do. It's the one that you will follow. And that means that you don't have to follow a specific protocol. You might look at all of the MS diets, I'll use in quotation marks, and pull recipes and, from different MS diets and know that you're accessing a healthy recipe. If you look at all of the MS diets together, you'll find that they're plant-based whole foods diets. With the exception of the ketogenic diet, that's really fallen out of favor, I think, because of adverse cardiovascular outcomes, when it's followed like a standard American follows it. So we're concentrating on a plant-based whole foods diet. That doesn't mean that you can never eat meat again. It means that when you're eating animal products or fish products, that you're eating high quality protein that's, grass-fed, grass-finished, no hormones, no antibiotics, fish that's not farmed. It's good resource. It's well resourced. That you're taking into account not just you, but also the earth when you're eating animal products, but that most of your plate is plants. If you need to follow a protocol, do so. Like I said, if you don't, use recipes from multiple healthy resources, and just know you're doing a good job. Recent research in MS proves that healthful diets improves brain health, like including the thickness of your cortex. It reduces inflammatory proteins, and it improves symptoms like fatigue, pain, and the sense of well-being. Healthy diets reduce the risk of vascular comorbidities, which steepen the slope of disability. So there's just no reason why you shouldn't do it. And yes, avocados are good for you. So with that, I will close. And I know that the programs that offer time for questions to be answered are just really valuable to you. And I'm happy to be here to answer your questions. So thank you for your time.
Thank you, Megan. And if you wouldn't mind just stopping sharing your screen so
Sure
people can
thing.
see
There you go.
There is one question in the question and answer. It's from an anonymous attendee who wants you to explain LDN.
Sure. So LDN stands for low dose naltrexone. Naltrexone is a medication that it's used for pain, and it actually blocks the opiate receptor. And so in lower doses, it is thought to have an anti-inflammatory effect. In lower doses, it's thought to be helpful for things like fatigue, chronic fatigue, nerve pain, and it doesn't have the same side effects as, say, someone who is taking who is using high dose naltrexone. And, there's I guess, and some buzz around opiates and, being able to, or being even asked to accept Narcan at a pharmacy to treat people who are on certain sedating medications that reduce the risk of overdose. And this is it gives people pause when they hear about naltrexone, because there are so many different uses for it in the high dose uh, uses of it. But when it's used in its normal doses, it's used to prevent opiate effects, and to reduce alcohol cravings. And in lower doses, it's thought to have these other effects on the brain. So I like to explain it as maybe a warm blanket to the brain. I didn't mention CBD, Sherry, in the pain pain or spasticity part, or the bladder part, and I really should have. CBD and even medical cannabis, if it's legal in your state, can have a role in those symptom management goals too.
Thank you.
Mhm.
For those of you who are joining us on Zoom, if you have a question, please type it into the question and answer box at the bottom of your screen. If you want to ask Megan a question personally, raise your hand. Again, that button's at the bottom of the screen. If you're on your cell phone, I see we have a couple of persons calling in on their cell phones. You have to dial *9 on your cell phone in order to raise your hand. So I'll try to keep my eye on that. We've got several questions in the Q&A. What supplements do you recommend for us with MS? So that's from an anonymous attendee.
Sure. So I think of supplements like medication. I guess I'm an amateur herbalist, and I look at drug interactions. I look at supplement and disease interactions with supplements. So I think that's best answered on a one-on-one with an integrative provider or an herbalist. But in general, you need to be sure that your vitamin D level is high enough. So sometimes people need to supplement with vitamin D, like dog. Sometimes people need B vitamins. These are things that you can measure. And if you don't have kidney issues, you may consider taking alpha lipoic acid, which may have some benefit long-term in disease progression. That's kind of panning out these days in larger studies. But anything beyond that, it's very personalized.
I would add to what Megan has said here that most of the combination supplements that you see, protein powders, bodybuilding things, have supplements in them that might boost the immune system, and you want to be very
Yes.
careful not to do that with multiple sclerosis.
Yeah, that's a great point. So many people say, well, should I take this? It said it boosts my immune system, or it's good for my immune system. And theoretically, those things could activate the disease because your immune system isn't deficient, it works wrong.
Shelley asks, I've just recently started dry needling. I'm aware that this is supposed to be similar to acupuncture, just deeper insertions. I've already noticed some improvement with spasticity, but was wondering how often this should be done to keep seeing improvement.
That's a great question. I'm glad you brought that up, Shelley. Dry needling is becoming more of a standardized practice among physical therapists, and it's a great technique. It is only similar to acupuncture because it uses needles. It does not have anything to do with meridians. They use the needles in trigger points to release provide myofascial release. So it's very different than acupuncture, but it does use needles. As far as the frequency with which you should do it, I honestly can't answer that. As a person who's not trained to do it, I would talk to it's probably a physical therapist who's doing it with you or a physical medicine and rehab physician. I would talk to them to ask them what the best frequency is.
Thank you. An anonymous attendee asks the penultimate question. What is the best way to break sugar addiction, which our diet in the US encourages with sugar put in so many foods?
Oh my gosh, it does, right? Like it's so hard to find even a salsa or a spaghetti sauce without sugar in it. I look at popsicle. It's summertime. These kids love popsicles, like old-fashioned popsicles, and I just cringe. Like every couple of months, I'll buy my son Rocket Pops, and I'm like, oh God, it's horrible. And I try to make them from home, but really the best way I've found personally and just in my own research is to make sure that you're getting enough protein and fat in your diet. When your body is full, it doesn't crave sugar. And so, higher protein meals, meals that are higher in healthy fats will keep you full longer. Meals that are higher in fiber will keep you full longer, and then you'll tend to not seek out the excess sugar. I would also say stress management is huge here. When we are anxious, depressed, nervous, in a hurry, we are animals and we seek that little hit of dopamine or serotonin or whatever it is for us. And man, that piece of chocolate or that cookie sure feels good when you're tired at 2 o'clock. So, if you can keep your bodies well fed, and if you can think about maybe coming up with a habit instead of that time of day when you're at risk for seeking sugar, maybe you decide to sit down and take 10 deep breaths. Maybe you decide to, go for a walk around your house or around your block or around your office. If you're walking, maybe you put on your favorite song. All of those things can give you a quick hit of feel-good chemistry that sugar doesn't take, that sugar gives you. And of course, those things are much healthier. I also love the book Intuitive Eating. There is a website that goes along with it. It's called intuitiveeating.org. And many of their principles can help you cut foods healthfully from your diet that are harmful for you.
Another tip that I learned when I was eliminating sugar was that when I really had that craving for sugar, if I just had a handful of peanuts or
Yes.
cashews,
Well,
it,
and
it was very
fat.
helpful. Yep.
Yeah, good fat, good healthy fat. And it actually, you know, it makes your cell walls work better, whereas sugar breaks them apart. So yeah, a handful of nuts works really well.
It does. Deborah would like you to talk about turmeric and curcumin.
Yeah, so curcumin is turmeric. The root, the powder, whatever it is that you're um what you're taking. There are different components of the plant. Supplements will, sometimes mix them. Uh, there is a lot of research in various different specialties with turmeric or curcumin. It ranges from cancer to cardiovascular to dementia prevention to pain, arthritic pain. There's some good It's a good study that says that taking curcumin 3 times a day over time can provide as good pain relief as Aleve twice a day, which with certainly lesser cardiovascular and kidney effects. So I think curcumin's a good supplement. Um, I think that in general, people, even including myself right now, probably take too many supplements, but I don't think you can go wrong with curcumin as long as it doesn't bother your stomach. Some people feel nauseous after they take it or have diarrhea. Some people have to try different brands before they find one that really works for them. But can I tell you that you're going to notice anything amazing that it's doing for you? Um, Probably if you're dosing it high enough for pain, you might, but otherwise it's just kind of like healthying up your soil.
Thank you. An
Yeah.
anonymous attendee has asked, besides cooling vests, are there any supplements or things that I can take for heat intolerance?
Gosh,
Water,
no.
water.
Yeah, water, cold water. Um, there are not supplements for heat intolerance. If there were, and I knew of one, I'd be a billionaire. But unfortunately, the biggest thing would be to manage your ambient temperature with cooling equipment, with water, to plan your activities around the coolest time of day. Maybe to get make sure that if you're driving, that you have the windshield protectors. In the state of Florida, you can actually get the super dark tint with a doctor's note for neurological conditions. Um, and something I learned from a patient with MS a long time ago was they would keep a cooler in their car in the summer. We live in Florida, right? So it's hot. The cars are like 120 degrees when you get in them. They would keep a cooler with ice packs in their car so that when they got in the car, they could immediately, use an ice pack or a cooling towel or something like that.
Janessa says, I have tremors, but it doesn't seem like my neurologist is concerned. I've actually backed off a few medications that didn't seem to help with my physical concerns. Any recommendations?
Yeah, so depending on the type of tremor that you have, if you have the type of tremor I think you have, it is very hard to treat it with medication. And so actually the side effects from medication could be worse. I tend to recommend working with a good occupational therapist. And the other thing that's really cool about the world these days is you can get anything on Amazon that you couldn't get 10 or 15 years ago without seeing an occupational therapist. And I've been recommending these hand weights to people. They're about 1 pound on the top of the back of your hand with like little loops that go around each finger, and they weigh down your tremor. And so as long as they don't cause arm fatigue, I have recommended these to people with all types of tremor, MS and not MS. And I would say 99% of the time, the feedback is good.
Amanda wants to know what the best meals are to eat. And I think you kind of covered that, but
Yeah. So the, the MS Focus website has resources for nutrition. So does and the magazine that comes out monthly is also on the website. And there have been phenomenal articles about nutrition over the years. But I would say in general, a plate that's full of mostly plants with animal protein or meat or protein as a condiment that is, free of processed sugar and trans fats, rich in omega-3s is the best type of meal to eat.
thank you. Stephanie adds some tips on eating. She says eating nuts decreases my sugar cravings,
Yep.
and cold watermelon helps with the heat
Oh,
intolerance.
that's great. Yes. Very, very good.
And Mike would like to know if there's any benefit to intermittent fasting.
Yeah, so I have a personal opinion on intermittent fasting that's not based on science, and it's similar to my personal opinion on diets. Anytime you do something for too long, your body gets used to it, particularly if it is denying your body nutrients that it needs. And so over time, intermittent fasting might cause your metabolic rate to decrease, and you might actually not benefit from it. Most of the benefit that I tend to think occurs with intermittent fasting is with intermittent fasting. So maybe you pick a day, once a week or every other week to, eat that during that 12-hour period or that 8-hour period or whatever it is for you. But for many people, people with diabetes, that can be dangerous. People with anxiety, that can be dangerous. And so I think you have to just really try different things and pick what's right for you. And that goes back to there is no one right diet for MS. The right diet for MS is the one that works for you and the one that you will follow within that armamentarium.
An anonymous attendee is talking about bowel incontinence. It's getting worse. They've had MS for 26 years. They feel they have to go, they have to move quickly. They're needing to do better with fiber and just purchased Metamucil. And they say, we know doctors and nurses want us to get it from our food, and I'm working on it. I've gotten better with water, but what else can I do to improve it?
So
Working
this
out has
anonymous
improved.
person is exactly the person who needs Metamucil. And don't feel bad about it. Yeah. This
Just
is
be sure
the
you drink enough water with
Yeah,
it.
yeah, you are exactly the type of person who needs to have Metamucil. When it gets to this point, um, there needs to be something, you need a little help from your friends, so to speak.
Catherine says that she has found rosemary tea helps with heat sensitivity.
Oh, cool.
Let's see. Lisa from Facebook asks, is there anything to help with foot drop? I'm wearing a brace now.
So yes, if you're wearing a brace, then I'm assuming you've been through physical therapy. You may consider returning to a physical therapist who's familiar with functional electric stimulators. So things like the Walk-Aid or the Bioness L300. There's also this new neural sleeve that it's like imagine like an old-fashioned knee brace, but it covers your whole leg, and there are stimulators for muscles in that device. But mainly, those are the most, I would say, the most modern resources we have for helping with foot drop, and then keep moving, keep moving, keep moving, keep moving.
Jennifer asks, have you had any experience with MS patients who are really sensitive to elevated humidity? People who have really bad MS symptoms on rainy days.
I would say yes, in the sense that many symptoms in general are worsened with barometric pressure changes like migraine, vertigo, joint aches and pains. I would say if you watch the weather, then oh, Mike uses a psionic neural sleeve. Great. Um, those are things that, maybe you can plan for if you see that there's going to be a big storm coming. Maybe that's a day that you don't plan to do 15 things, right? Or the day after that, however the day is bad for you. I know as a migrainer, however you say it, I'm very sensitive to barometric pressure changes. And so I plan to do different types of exercise on days when we have big storms coming through, because, what I would usually do is going to give me a headache. So you just kind of have to plan for it.
We have one question in the queue at this point, and then folks, I think we're going to need to call it quits because it's 8 o'clock and Megan has a sick kiddo and she hasn't had supper yet. So Christina asks
And I
numbness.
really want a cookie, but I'm going to.
Christina asks numbness, what can help? And also
I'll
There's
be
a
right there,
question in
bud.
the chat on burning feet, if there's anything. I think those two
You
kind
know,
of,
that's a great way to like end because there's a problem with numbness. And the problem with numbness is that medicines for neuropathy and for nerve pain don't make numbness go away. They improve the discomfort of numbness. So unfortunately, there is not a medicine that makes numbness go away or a supplement that makes numbness go away. I would say that, and so to the burning feet, any suggestions? There are plenty of medicines that we talked about that can help with burning feet. Also, the supplement alpha lipoic acid. Oh, thank you. Have a cookie. Yes. um, unfortunately I'm out of those. I might make one. But the supplement alpha lipoic acid that I mentioned has good data for pain relief in diabetic neuropathy, and I've had success with it in all types of neuropathic pain. And I would say that as a rule, any of those energy and alternative techniques that I mentioned, like acupuncture, acupressure, Reiki, and even biofeedback, could help with those types of symptoms.
the other thing that I've found personally is that CBD oil
Yes,
applied over the spot of burning or um, even numbness does tend to help.
yes, thank
And,
you.
and in the lower doses of CBD, I wasn't getting quite the help with. I've got a patch of neuropathy on the side of my leg that will fire when I'm in the shower and water hits it, or when
Oh
I'm out
yeah,
walking and the wind blows over it. And CBD oil applied over that area does tend to help that.
yeah, great suggestion. I totally failed to include CBD in my discussion, so I'm glad there was room to add it in.
Thank you all for coming. Thank you, Megan. I know that this has been a crazy day for you, and we're just so grateful that you're sharing yourself and your knowledge with us at this point.
Thank
For
you.
those of you that are on Zoom, please stay on the line for just a bit longer. When the webinar ends, you will be asked a brief survey to help us to give some input as to how we can better meet your needs as far as the webinars that we produce. And I I'm remiss here because nobody told me, and I don't have my calendar in front of me, what the next offering that we have is. Next week, several of our staff are going to be in Nashville, Tennessee at the Consortium of Multiple Sclerosis Center annual meeting. And I believe on the 18th of June at 3 o'clock in the afternoon, some of us that did go to the consortium are going to be giving you an overview of what we heard at the consortium, what
Cool.
might be coming down the pipeline for treatment, what recommendations are for different things within the arena. I'm hoping to hear more about aging with MS. So stay tuned for that. Aha, the next webinar is Wednesday, June 11th with Dr. Ben Thrower. And so join us for him and we will see you. He's going to be doing updates on MS and cannabis.
Wonderful. He does a
Wonderful.
great job with that. He's definitely the expert.
Thank you so much, everybody. We really appreciate you joining us. And for those that are on Zoom, please stay on the line. And this live stream will be sitting on our Facebook pages. So if you want to review it, go to any one of our Facebook pages. Uh, and
I'm coming, bud.
oh, go to Dane.
Have a great
Bye.
night, everybody. I'm going to hang up.
Alrighty, bye bye. Take care.